Hello and welcome to the Ask Dr. Payne segment. We got a question in recently regarding a thigh lift. Patient had a thigh lift done, and there was what they call a T scar, where there was a scar in the groin and then one down the leg, and there was a breakdown, and the person had to have the wound closed with a wound vac device. And now they're left with a kind of a wide, depressed scar, and there's also a lot of excess skin of the thigh, and they're interested in getting it fixed. And the question was, when should they get that done? How long should they wait? And what could be expected? And can they have more skin excised? Well, the short answer is yes, more can be done. And when I looked at the pictures, it looked like things were well healed, but it has only been a couple of months since things have sealed over. I usually recommend waiting a long enough period of time until the tissue has completely softened up. That is from the time that the healing is achieved, and usually is about 3 to 6 months, depending on how long the original surgery was and how much problems there were with the healing. And also, we need to know a little bit more here about the person's medical history. Is there any smoking and so forth? Because that kind of breakdown can occur when there's two incisions joined together, especially if somebody has medical problems or smokes cigarettes. Those are a big no-no with this kind of surgery. If somebody has uncontrolled medical issues or is actively smoking, a lot of surgeons won't do it at all. I will tell people they've got to control those things as best as possible, but if any of that is present, they have a higher than average risk of having a wound break down. That being said, we've never had one break down like what I saw in this picture. And also, there is a lot of extra skin left over. So what I would say is the person already has the incision down the leg. They're going to do best with a revision, not only scar revision, but a secondary thigh lift to get more of that excess skin out. It doesn't make sense in this case just to revise the scar. If you've got the excess skin, and I don't know how much was there to begin with, so I don't want to criticize the result too much. But I would say a full revision thigh lift with all the medical problems optimized. And again, we have very little problems with this kind of procedure, but you have to be careful. Not all surgeons want to do thigh lifts because they are a little bit trickier in terms of getting good healing. So you might want to get some consultations, ask around. If you think the surgeon isn't really comfortable with it and they're just kind of willing to do it or something like that, you might want to look around until you find someone that's more enthusiastic about the procedure, because it's not an area that you want to have problems, especially in this case. This person already had a problem, and I would say it can be done. Search around for the right surgeon to get it taken care of, and make sure all medical problems and everything are optimized. Follow all the instructions, and you have a good chance of getting improved outcome from where you are now. So I hope that covers it, and we will talk to you next time.